Absolutely. I think if we look at the way healthcare is evolving, we are faced with many more people who actually have chronic conditions like diabetes, hypertension, cholesterol, and all of these have actually come about because of the lifestyles that we have been leading in the past. Now, governments, insurers have all recognized that it's going to be so much more effective to actually prevent a condition as opposed to treating it. So I think all of these, looking at healthier foods, healthier lifestyles, comes down to the consumer taking more ownership of their health, which also means that it's ownership not just in terms of what they eat and what they do, but we're also now seeing a shift towards ownership in terms of how they actually spend money on health. So for example, if you take the case of Oscar Health, consumers also now are going to have to pay more, whether it's for health insurance or governments are pushing consumers to make sure they do also have private health insurance so that there's not a full burden on the government. So consumers now have to take and look and see what are some of the different options that are available to them so they have that form of backup, which is not purely public dependency as well.
Yeah, that's interesting when it comes to having the consumer more exposed. That, of course, increases the incentives, I would imagine, for preventative care. But you also talk about this model of moving from volume-based to value-based care. Can you explain that in a bit more detail? And who, if anyone, is doing this right at the moment?
Sure. So the traditional healthcare model has been payment-based for service. So, you go and see a general practitioner and you pay a certain fee for the service that you get. You go into a hospital, you pay a certain fee for procedure. So the way the industry has been structured is, healthcare providers get compensated based on services that they provide. What is happening now, though, is that we are seeing governments, like, it started in the US as well, looking at, instead of a fee for service, there's going to be a fee for outcomes. So the service that's provided has to be able to be linked to a certain outcome, which means that the healthcare provider gets paid for meeting that outcome as opposed to just providing a service. The idea is that this would, manage the number of tests that are being done, duplication, and ultimately, in the longer term, save some money or help us to use the money that we have in the healthcare system in a more efficient manner.
Hey everybody, it's Hadley Gamble from our new CNBC Middle East Bureau in Abu Dhabi. Thanks for stopping by. Now to watch more, you can try one of the videos that just popped up on your screen. And don't forget to subscribe.